Hello, everyone, and welcome to week 21 and 22's recap of 2018's My Diet Starts Monday. Now, it's been my experience if you ask someone if they're healthy, they usually come back and say, yeah, I feel good. Whoa, wait a minute, that's not what I asked. And unfortunately, many people base their health on how they feel, either the presence or the absence of symptoms. Now, just for the record, it is the most horrible way of thinking and the largest downfall of many people's health. Really? Why is that? Shouldn't I base my health on my symptoms? Good question. Let me ask you this. Is it possible to be sick and still feel fine? Absolutely. Okay, I see what you're saying. Now, if you didn't know that, you heard it here first. That's right, you can feel totally fine, be free of any and all symptoms, and at the same time be very, very sick. So in order to understand this, we need to spend a few minutes on the concept of symptoms. Okay, so what's a symptom? Well, it's a smoke alarm. It's telling you that there's something else much more dangerous that's going on. It's not the smoke alarm that's the problem. Nobody wakes up in the middle of the night to a smoke alarm, stumbles down the hallway through heat and smoke, takes the battery out of the smoke alarm, throws it in the trash, puts the plate back on, and then goes back to bed. You see, focusing on the signal rather than the cause of the signal is a huge weakness in our traditional, conventional medical approach. On top of that, it is said that an estimated 40 to 60% of tissue damage, disease, or death needs to take place before you feel that anything is wrong. Now, just like the smoke alarm, if you lit a match in your house and quickly blew it out, you would have smoke in your house. But it wouldn't be enough to trigger the smoke alarm. Not a chance. Smoke levels need to rise to a certain level before it triggers the alarm. And with the body, that damage needs to rise to a certain level before you feel any symptoms. Now, ironically, most people practice this concept of not waiting until things get so bad with things other than their health. Take your car, for example. Most people don't wait until their check oil dashboard light comes on to have their levels checked. I'd say most people have it checked every 3,000 miles as recommended. They don't wait until the dummy light goes on. Yes, those dashboard lights are called dummy lights. Because everybody knows you got to be a dummy to wait for the light to go on to tell you to do something about it. It's not the best way to go. And just like nobody takes the battery out of the smoke alarm to solve the problem, no mechanic is going to reach under the hood, clip the wire going to the dashboard light, shut the hood, and tell you your dashboard light's not on anymore. You're good to go. Now, if your mechanic did that, I doubt that you would ever go back to that mechanic again. But it seems to be the very approach that we're taking of waiting for a signal, focus on silencing the signal, without addressing the problem is exactly what we're doing when it comes to our health. We wait until the problem has progressed, until it's so bad. And then on top of that, we take the approach of silencing the alarm rather than looking for the cause. Most drugs don't solve the problem, they just mask the symptom. And if you don't know if your medication is masking or fixing, just ask yourself, what would happen if you stopped taking it? Would the problem come back? If it would, it's not fixing anything. And by taking this approach of silencing the symptom without addressing the cause, you allow the problem to progress and get worse. You're allowing the fire to go from one room to the whole house. Similarly, you're allowing the lack of oil to have an impact on the entire engine. Symptoms are not early warning signals. They are very late warning signals. Most major health concerns don't have any warning signals until it is very advanced. What does osteoporosis feel like? What does high blood pressure feel like? Elevated cholesterol? Diabetes? How about a cavity? You tell me, can you have stage 3 cancer and not know it? How about stage 4? You see what I mean? It happens all the time. My dad had to have 70 to 90% of coronary artery blockage in 5 arteries before he even felt anything. And for some, the first sign or symptom that something is wrong with your heart is a full-blown heart attack. Yeah, that's a problem. Okay, so I think I get it. What you're saying is regular cleanings for your teeth, even though you don't have a toothache, annual checkups with your physician, even though you feel good, oil changes every 3,000 miles, even though your dashboard lights aren't coming on, and regular chiropractic adjustments, even though your neck, back, and joints aren't painful. Don't wait for the dummy light to come on because prevention is the best medicine. So, Doc, what is your recommendation for active care and wellness care? You know, how often should I come in? Once a week if you're feeling it, once a month if you're not. I see patients usually once or twice a week for active care and recovery, and usually once a month after that for wellness care. Listen, if you're suffering from pain and discomfort and would like to get well and stay well, our comprehensive holistic approach might be the answer. Because let's face it, chronic pain in arthritic joints is a total drag. Do today what others won't so tomorrow you can do what others can't. Get in alignment. Because it is better to be in alignment than out of alignment every single time. We will see you at the next post. Next week.